up, defining low T. The term is often used to market testosterone products to older men, but are they worth it? And are younger men dealing with this as well? So stick around, because coming up in just a few minutes, we're going to be asking Dr. Mark Hong about this. He is in our open door green room, and he'll be joining us in studio. Hey, Dr. Hong.
Hey, Dr.
Sit
Hong.
back and chill and relax. In your Health Watch this Wednesday morning, you've probably heard about reports about low testosterone now affecting younger and younger men, even though it's always been an issue associated with aging. So is that really the case, and what could be causing this? A urologist, Dr. Mark Hong, joining us in studio this morning with what men should be asking their doctor and what they need to know. Good morning to you.
Good morning, Scott.
We've known for a long time that testosterone treatments are really good for certain men, right?
Yeah, so we know that, first of all, testosterone is one of the essential male hormones, and it regulates a lot of things in our body, keeps our muscles good, keeps our overall health good. But the question is whether we should be thinking about replacing it at a certain point.
Yeah, because normally, I mean, I hear men maybe in their 40s, 50s that do it, but how, I mean, 20s?
Yeah, so there's been some sort of new talk, especially online, about a trend towards younger men having low testosterone and therefore what to do about it.
What would cause that?
Yeah, so nowadays, I mean, just living in this modern world, right, we got a lot of pressures.
Right.
First of all, how many of us are getting good sleep? I mean, did you get good sleep last night, Scott?
I have no idea what you're talking about.
Right, exactly. Well, it turns out the studies have shown that if you just compromise even a few hours a night, your testosterone levels actually drop just from that.
Okay.
And then, of course, nowadays, you've also got stress, right? That can affect your cortisol. That also can affect your testosterone. You got nutrition. You got obesity. And you've also got even the use of pain pills. And these are all things that can affect your testosterone.
Okay. Well, you know, it depends who you talk to. Some doctors aren't really, they don't think favorably of testosterone treatments. Others think it's great. You do it in your practice. What would you say to young men then?
Yeah, so I think number one, whether it's young men or older men, if you're thinking about getting on testosterone therapy, just make sure that you're doing it safely, right? So make sure you actually get your blood levels drawn. For young guys, you got to understand that if you're on testosterone, it could actually knock out your fertility. So if you're looking to conceive, then you got to make sure you understand that, whether it's from me, your doctor, or from the guy at the gym.
Okay. I've heard that if you do these treatments that your own testosterone stops developing. Is that true?
By giving your body testosterone, it makes it think like it's producing enough, and it can shut down your own testosterone. Having said that, if you can do it safely and in the proper individual, you can see a significant benefit in a lot of these parameters.
So what if you're younger and you start taking these treatments? What about other issues other than what you're talking about?
Yeah, so number one, that's why it's really important to check your blood levels.
Right.
So you want to know where you're at. Also, you want to know what your goals are. So let me, kind of ask them, what's your goals? Do you want just more energy? You want to get a better workout? What are we trying to do here? Because it actually turns out that maybe testosterone isn't going to be the thing that gets you there. Maybe it's some other things. We look at your nutrition. We look at your sleep habits. We look at how you manage stress. What kinds of things that you're eating that lead to low testosterone. So these are things that I think are worth looking at before you get on a treatment. Because, of course, once you're on testosterone therapy, you may end up just staying on it for the rest of your life. All
right, so definitely check into your life and how you're living and other things that you can look into. We're about out of time. What percentage of your patients would be younger men, you think?
Well, I have a significant amount of younger patients. Of course, it depends how you define young, but I think overall, though, it's just I use the same approach. What are your goals, and what's the issue? And how do we get there?
Yeah, okay. Dr. Hong, thank you so much. Anybody younger than me is young.
You're young, Scott.
Younger than me.